Really?
Well, first you should figure out if your finances can handle a little one. Certified financial planner Andrea Cave with Preferred Financial Group is here to break down the costs of having a baby, and there are many.
There are many. What I was talking about is you find out, you mentioned 9 months or 8, whatever the number is, and you have that time to plan.
Right.
And there's things, if you fall in between calendar years, you can take a look at your health insurance plan at work and see if you can change from, let's say, a high deductible plan, or if you keep a high deductible plan, if you can qualify for an HSA or FSA to kind of take a little of that sting off. The average cost, the average cost of having a baby is anywhere between $7,000 to $25,000, $7,000 to $25,000, depending. That's the pre-health insurance cost. And if you have health insurance, that cost is lower, not only for you, but your providers negotiated a lower cost. But in addition to whether you have a C-section or a vaginal birth, which tie right into what that cost will be to you bottom line, you wind up paying co-pays, your deductible. There's prenatal vitamins and health that you need to take into consideration, all expensive. But some things to factor when trying to come up with a budget for when you do deliver and you have that bundle of joy. We talked a little, if you are working, you have some maternity, maybe short-term disability or some paid time off, kind of budget to what that will mean. And I was reading an article that did say that an average baby in their first several months will use anywhere between 8 to 12 diapers, which I said is 300 to 400 diapers a month, which you should average somewhere between $75 to $125 a month just for disposable diapers. That's not including wipes, that's not including the formula. So not to scare you, having a baby is a wonderful thing. In fact, I was visiting my best friend who had a newborn just yesterday, and you can't replace that with a dollar amount, but it's good to be prepared if you can.
Right, because it's not something that you can say, you know, we'll just push the diapers, we'll get them next week, because we can't afford them this week. I mean, babies need what they need when they need it.
That's right, and there's care afterwards, extra doctor's visits, medications
and then you roll into
they may
daycare if you need it. And
that's right.
That's a huge income crippler,
It's a good supplement to think of when you have employer benefits, and you normally get to choose that just one time a year. And also beware of some small details that all companies have the right to include. For example, if you don't call when you're at the hospital to add your baby, they can deny coverage. If you don't know exactly ahead of time what the cost will be, it can really be a big sticker shock for you if it's not covered. A good example, a lot of doctor's offices will advise that you get some genetic testing or some lab work. Usually you can know that ahead of time. Find out if your insurance company covers that before you go through with it, so you don't wind up with a big bill that you weren't expecting. And oftentimes, something good to know is if you do wind up having something that isn't covered, you can approach the doctor's office or the specialist ahead of time and find out if you're going to pay on your own without insurance, if you can have any kind of a reduction in cost, a payment plan, if they'll reduce the cost if you pay it in a lump sum. I mean, there's a lot of things you can do to try to keep your costs down in relationship to having that baby.
All right. Thank you so much.
You're
Great
welcome.
advice.
Thanks.
You need an Excel spreadsheet.
But they're worth it, aren't they? If you got a question for our experts, you can email them at asktheexpert at today'stmj4.com. You can also leave a voicemail